The paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
Whenever you hear it's cancer, you have to really step back and look at your life.
That man's cancer was caught in time thanks to a screening colonoscopy that many are delaying. Good afternoon and welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. Our focus today is colon health. Colon cancer strikes both men and women and is the second leading cause of cancer death in our country. If you're watching us live now and you have questions concerning colon health, symptoms, or that all-important colonoscopy, our operators are standing by to take your calls. In Wake County, call 919-744-3876. Outside of Wake County, you can call us toll-free 877-277-6252. Your questions may be answered here live on our program by our experts. Those experts answering your questions are gastroenterologist Dr. Rig Patel with Digestive Healthcare and surgical oncologist Dr. Yael Podnos with Rex Surgical Specialist. Again, to submit your questions here at Rex on Call, just dial the number on your screen, Wake County 919-744-3876. Outside of Wake County, toll free 877-277-6252. If you're watching us as we're streaming live on WRAL.com, email us your questions to rexoncall@rexhealth.com. You can even find us on Twitter. Send us a message at Rex Healthcare, #RexOnCall. While you're calling in with those questions, listen up. We've all heard about the colonoscopy. It's probably the most universally dreaded of all the cancer screenings because of what you have to do to prepare for you. But experts agree colonoscopies save lives. New research released just last month confirms colonoscopy, in which doctors find and remove precancerous growths, reduce colon cancer by 53%. 53%. So if you meet these guidelines we're about to show you, call your doctor and schedule one. Here we go. Take a look at this. If you're 50 or older, get a colonoscopy. 45 and older, if you're African American, get a colonoscopy. 40 or older and you have a family history or other risk factors, call your doctor and get a screening colonoscopy. Now, if we have not been able to convince you, take a listen to our next patient here. He got a screening colonoscopy and it caught the cancer in time.
He had put it off for a few years, but when Victor Kiefer had his first colonoscopy at age 53, he didn't have any symptoms. He does have a family history of colon issues. His father had surgery to remove a mass in his colon.
I think everyone puts it off. Tomorrow's always a better day. And after seeing and then the fear of my father's actually being cancer, definitely moved me to have it checked myself.
After waking from his colonoscopy, he was faced with some startling news.
I knew it wasn't a good thing whenever you have to meet in the little room afterwards.
Surgery to remove the tumor they discovered in the colonoscopy revealed Victor had stage 3 colon cancer.
Whenever you hear it's cancer, you have to really step back and look at your life, and you don't know what's going to happen next.
Victor credits that colonoscopy for saving his life. Gastroenterologist Dr. Bulent Ender fears many are foregoing this crucial cancer screening test because of what happens the day before.
It's somewhat baffling because it's not that big of a deal. We ask patients to be on a clear liquid diet for a day and then to take a bowel cleansing solution. And most people tolerate it very well. Some actually feel great with the cleansing.
Without a doubt, Dr. Ender says it's one of the most important cancer screening tests that can actually prevent a cancer from developing in the first place. And about the day before cleanse, you have to do it.
The importance of this cleansing cannot be overstated because the quality of the physician's examination ultimately depends on the quality of the patient's bowel prep.
Victor had a successful surgery to remove his tumor. He didn't require chemotherapy. A year later, tests show he's cancer-free, all because of that colonoscopy.
So don't put it off. Just don't put it off. You know, have the colon checked. You know, it's definitely an unpleasant thing to prepare for it. That part can't be taken out, but the results can save your life.
And joining us now on set is Dr. Rig Patel and Dr. E.L. Podnos, and we have a lot of questions coming in already. But first, let's talk to you, Dr. Podnos. There have been some real advances in the surgical techniques for treating colorectal cancer. Tell us about that.
Well, over the past 15, 20 years, laparoscopy and minimally invasive surgery have really revolutionized surgery in general. And this has really accelerated over the past couple of years to the fact that now we're doing things through one belly button incision about this big. Things that we used to do, huge incisions for. And what that corresponds to is less patient pain, fewer days in the hospital. People get up and resume their lives quicker, better. It's really quite a dramatic improvement over what we were doing previously.
And you could, how does it compare? You used to be in the hospital for a week or so after?
5 to 7 days, and now it's 2 to 3.
And they're up and around and moving around. Okay, we have some questions in, and this one actually came from Lisa from Apex, talking about the 50 and under age group in colon cancer. A lot of doctors are getting these symptoms from 30-year-olds and not really thinking colon cancer. Dr. Patel, tell us, what should doctors be doing to really cut this down?
That's a great question from Lisa, actually. It's a very topical question because the incidence of colon cancer has started to go down in people over the age of 50, which is great because we're starting to screen. The fastest rate of growth is in the younger people, actually between 20 and 29. And it's not very common, but the rate of growth is concerning. And we think it might be environmental, dietary. So we have to be concerned about people under the age of 50. It's a change in bowel habit, abdominal pain, bleeding in particular. Talk to your doctor, get early screening, listen to your body. It's really important.
And what should you be asking your doctor when you're meeting with your doctor for the first time, or gastroenterologist, about the procedure? What should you be asking them?
Well, asking them about where they do it, how they do it, and what the bowel preparation involves, and understanding why they're having it done. I think those are the important things.
Okay, and in terms of looking for surgery, what sort of techniques, what should they be asking a surgeon in terms of the techniques they use if they do find something?
I think foremost would be how many of these the surgeon does. Because with anything, the more we do, the better we are at it. Mm-hmm. And then we could start asking, do they do it laparoscopically or single incision laparoscopy? Because what we've done is we've honed down the number of incisions and the size of incisions. Mm-hmm. And so those who are able to do it with fewer or smaller incisions, it just corresponds to a better patient outcome.
And you guys have really taken the lead in terms of endoscopic ultrasound, in terms of staging these cancers. Tell us about that.
Well, endoscopic ultrasound is used for staging rectal cancer. It really helps us determine which order of treatment to do, because we regard rectal cancer as curable. So if you give the order in the right treatment order, you're going to get a better chance of cure. And what endoscopic ultrasound does, it looks at rectal cancers and sees how far through the wall it's gone. If it's gone through the wall, then you want to get preoperative chemoradiation therapy before someone like Dr. Podnos can go and resect it. If it hasn't gone through the wall and there's no lymph nodes, no evidence of spread, it's a really good idea to go and have the surgery directly. But it's important to do it in the right order.
That's so good to know. We have a question from Jane in Wake Forest. She was diagnosed with colon cancer in 2002. She had a resection, no other treatment, and has had yearly colonoscopies, but now her doctor said she can wait 3 years. It seems like she's a little nervous about that. Is that fine that she waits 3 years?
Yeah, I think as long as she doesn't have any strong family history, or she doesn't have what we call a colon cancer syndrome, then spreading out to 3 years is reasonable, as long as she doesn't forget at 3 years.
Okay. We're back after the break to answer more of your questions. To phone us here at Rex on Call, just dial the number on your screen. In Wake County, 919-744-3876. Outside of Wake County, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions, rexoncall@rexhealth.com. And on Twitter, lots of ways to find us today, at Rex Healthcare, #RexOnCall. When we come back, we'll hear from yet another patient who says a colonoscopy saved his life. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on colon health. If you have questions for our experts, call one of those numbers on the screen. We have a lot of questions to get to, so let's get straight to it. This is from Veronica in Lewisburg. Should 2 precancerous polyps in the past, how can you prevent from these how can you prevent polyps?
That's a really good question. We think there are probably a lot of environmental factors, and there's a lot of research being done. And fast food is one of the things. Diet. We know that between 1970 and 1990, there was a 5-fold increase in fast food consumption in children. And as I was mentioning before, we're seeing an increase in colon cancer in young people. So diet. And some of the research that is out there suggests not eating too much red or processed meat. Make sure you eat at least 5 servings of fruit or vegetables, which not many people do. Berries, blueberries. Make sure there's enough calcium in your diet. Don't smoke. Exercise 5 times a week. All those things have been associated with a lower incidence of colon cancer. So really good, healthy lifestyle is the bottom line.
Okay.
This has come out even more important as we find that immigrants, as their generations live in this country further and adopt an American lifestyle, an American diet, they tend to have the American chances of getting cancer as opposed to where they had originally came from.
Interesting. Okay, this is again about family history. Wants to know, he has a strong family history. How long should he go between colonoscopy procedures? He's 56 years old.
Assuming that he doesn't, again, have a genetic syndrome, and you are suspicious of a genetic syndrome if there are several family members who get colon cancer, breast cancer, gynecological cancers, particularly if they're below the age of 50. If you've just got 1 or 2 family members who've got the cancer, you generally don't want to go more than 5 years without a colonoscopy.
Okay, and this is a question that's apparently very popular here. A 54-year-old male with wants a colonoscopy but low on funds. How do they proceed in terms of?
I think it's important to talk to your doctor. There are lots of different ways to try and get screening. The bare minimum way is to check the stool for blood. I think that's the bare minimum way of checking for potential of a lesion in the colon. But talking to your doctor and looking for different options, there are certain hospitals that will do it. Rex Hospital will do it with the Rex Foundation. So there are options to be able to look for it.
There are options. Okay. This is questions from Smithfield. Upper gastric pain, UGI, and ultrasound on the gallbladder. What's the next step? Is that a question we can answer here?
Well, I think that the first thing is to continue to follow up with the doctor, because that's always good news when an upper GI and a gallbladder ultrasound are normal, but that still doesn't explain why somebody's having these pains. And so there's some other things in there that we need to see, labs, and certainly if there's any lower GI symptoms, blood, things that Dr. Patel had spoken about, it would need further evaluations.
Okay, we've had a couple questions come in about the symptoms of colon cancer. Can you give us any idea in terms of symptoms, what people should be looking for?
The most important thing to remember, the most common symptom of polyps and colon cancer is no symptoms. That's the most important thing.
That's scary.
Yes, which is why get screened. But symptoms such as bleeding, change in bowel habit, unexplained anemia, abdominal pain, weight loss, those are the common ones, but you don't want to wait till you get symptoms.
Okay. I hope we've convinced you to call your doctor and schedule that colonoscopy. If you have symptoms or fall within the recommended guidelines, get a colonoscopy. Get over it. If not, maybe Wayne Poole can convince you.
Wayne Poole's only clue that something was wrong?
Over the Christmas holiday, I had what we thought was a stomach virus or maybe a flu coming on. Went on for about 24 hours and I recovered, and my wife and I both thought, well, mostly my wife said, I think it's time for a really thorough checkup.
Just last month, a colonoscopy revealed a tumor. It's stage 3 colon cancer. Now the 67-year-old is telling anyone who will listen to get a screening colonoscopy.
I tell them, get checked up. Yeah, I think 2 or 3 have been convinced already. They realize how serious it is, and it's not that big a deal.
Wayne is just now starting chemotherapy, and he's optimistic about his future.
You know, I feel like I'm a healthy guy for the most part, and I think they recognize that. So I think the outcome can, certainly be, we're giving it our best. I mean, we should have a good outcome.
certainly wish Wayne good luck and good health as he starts his chemotherapy. And coming up, we're going to be answering more of your questions. In Wake County, call 919-744-3876. Outside of Wake County, toll free 877-277-6252. Email us your questions at rexoncall@rexhealth.com. We'll be right back. Welcome back to Rex on Call here live on WRAL. To reach us here at Rex on Call today, call 919-744-3876 if you're inside Wake County. Outside of Wake County, call us toll free at 877-277-6252. Email us rexoncall@rexhealth. And we're taking questions for Dr. Rig Patel and Dr. Yael Podnos. We have a lot to get through, so let's get going. Mrs. Osborne from Fayetteville, she had hernia surgery with mesh. She had hernia repair a few years ago. Is she more prone to a puncture during her next colonoscopy?
I'll make the assumption that it's an abdominal wall hernia and not an internal hernia, but no, these are remote from where Dr. Patel and his colleagues would be doing a colonoscopy.
Okay. This is Joyce from Fayetteville, a 35-year-old with a family history of colon cancer, was told that too young for the procedure. What should she do?
That's a good question, and it depends on what age that family member had colon cancer. If they're a first-degree family member, you generally want to, at the latest, start colon cancer screening at age 40. But the rule we use is 10 years younger than when that family member was diagnosed. So if you have a family member that was diagnosed at age 40, you should start screening at age 30. So it depends on that particular history.
Okay, so this is Anna from Durham. After cleaning out for the colonoscopy, is there anything you can do to regularly to stay cleaned out? So should you be buying those cleanses that you see in the drugstore?
I'm not a great fan of cleansers. I think a healthy diet, making sure you drink enough water, have enough fiber. You need about 25 to 30 grams of fiber a day. And that's the best way to keep yourself regular on a natural way.
Right, remember, being cleaned out is not a natural state for us.
Yeah. Okay, so diarrhea after partial colectomy a year ago, what can she do about this?
I know this is going to be a recurring theme, but it's fiber. Even though it helps regulate us in terms of keeping us regular and daily, it also helps add bulk. And so people who've had colectomies and have some kind of loose stools or diarrhea thereafter, fiber's been shown to help really wonderfully.
Okay, this is from Bonnie in Raleigh. She's got a colonoscopy tomorrow. Go Bonnie. Now, now this says asthma, and she's I guess should she still take her medicine up until the colonoscopy?
Yes, in general, and if the asthma is very bad, you need to call your doctor, but generally keep your same medications, usually accept the diabetes medications before your procedure.
Okay, and this is from Betty in Lewisburg. She's 70 years old and had a colonoscopy, and the doctor said there's no need to have another one. Does she keep needing to have them if she's over 70?
Yes, some people talk about stopping screening and surveillance at age 75, but I individualize it to the patient. She would next be due at age 80, and at that time she should talk to a doctor if it's appropriate at that time.
Okay, this is from Cindy in Wake County. Could you explain what causes colitis? in terms of prevention, and she's had 2 different episodes. Is there anything she can do to prevent those episodes?
Lots of different causes of colitis. Infection, autoimmune colitis, medications can cause it. So first find out what the colitis was from.
Is there a way to find out what the colitis is from?
Yes, generally your doctor might have a good idea whether they thought she had an infection or whether it was Crohn's disease or ulcerative colitis.
This one was ischemic, and so the blood vessels that go to the colon are the same ones going to the heart, and that causes stroke. So it's really overall cardiovascular health in that circumstance.
Okay, and this is a question from Oxford. The patient has previous abdominal surgery. The doctor was unable to get colonoscope to pass. Do you recommend more studies other than the barium enema study?
Yes, you know, sometimes we see that where there's so much scar tissue that it's dangerous to keep trying to push the colonoscope. So a barium enema is a very good way to rule out large polyps or large lesions. It's not as accurate as a colonoscopy, and then a barium enema again in about 5 years.
Okay. This is Willie from Dunn. How often should he get a colonoscopy? He's 71 years old, and he had his last one in 2003. So
every 10 years.
So, okay. Erica, irritable bowel syndrome. Possible cancer with a colonoscopy? Having trouble reading this question. Does this increase your chances of cancer if she has irritable bowel syndrome?
No, generally not. But you want to make sure your symptoms of irritable bowel syndrome are irritable bowel syndrome, and particularly if it's a new symptom, then you need to talk to your doctor.
Okay. Real quickly, Lynn from Henderson, brother and sister both had polyps. When does she need to get screening, and should it be done before she's 50 if both her brother and sister had polyps?
If she had brother and sister had polyps, so start at age 40, particularly if they're the precancerous types of polyps.
Okay, we're going to have a final round of questions after this break. This is Rex on Call. There they went. Welcome back to the show. This is Rex on Call. We're taking a final round of your questions. Let's get to it. So this is from Cumberland County. This person had a rectal tumor recently removed. Now she has colostomy. When should she have her next colonoscopy?
I think that somebody with, it depends upon the rectal tumor. I imagine that they probably would have had an endoscopic ultrasound that Dr. Patel talked about. Next colonoscopy would probably be about a year after treatment started. Should she remind her doctor? I think that you have to take responsibility for this yourself, right? Your doctor may not send you a reminder. I'm sure your doctor will remember, but it's always best to be your own advocate as well. Absolutely. Okay, this is from Jane in Nashville. Colon cancer in 2011, anoscopies leaked? Anastomosis. Okay, and ended up with a colostomy. Has not seen an oncologist. Should she see one? Well, I'm sorry that happened to Jane. The anastomotic leaks happen infrequently, but they do happen. Whether or not she needs to see an oncologist really depends upon what the lymph nodes in the specimen showed. If there were lymph nodes positive, or if there were some genetic or cellular things in it that make us worry, then she should probably see one. Okay, and here's not a question, but a statement from Pam. She has had colonoscopies, and no question, but she wants to tell everyone to get screened. Absolutely. Okay, and there have been a lot of questions regarding constipation, and it seems like it's a broken record here. More fiber, drink water. Is there any medication these folks should be looking for? There's a lot of medications over the counter, and I'd caution with that. You know, make sure you use medications with the guidance of a physician. You don't want to be masking something. You want to be taking the right types of medications, even if there
are over the counter, and even if they are natural medications, talk to your doctor.
Okay, and I think that it's very common. People have been putting off this colonoscopy screening because of what you have to do the day before, but it's not. You know, the only option is not drinking that gallon anymore. There are some other options.
Absolutely. In fact, now we do what's called a split prep, which you actually get a better look inside the colon. So you drink somewhere between 3 to 5 glasses of the laxative, and then you take a break. You go to sleep, and then early in the morning you drink another 3 to 5, and that's pretty much it. You don't eat during the day before the procedure, and that's it. Now, some people do find that uncomfortable and inconvenient, but it's not painful, and it really is life-saving.
And talk about sedation. There's some great new anesthesia, so people are waking up ready to go.
Yes, absolutely. I mean, now we get to the point where we can guarantee patients won't feel any discomfort. So a lot of us are using sedation where patients go to sleep, they have the procedure, and they wake up without any drowsiness, no nausea, and they go home and get on with their day.
Okay, great. Thank you guys so much, and thank you for our phone bank. Still answering the questions. As always, consult with your physician about any health concerns. Thank you very much, Dr. Patel and Dr. Podnos. And thanks, our phone bank, still working hard over there. Join us next month for Rex on Call. Our topic will be allergies. I already have a lot of questions, and just in time for all that pollen, you can email us your allergy questions ahead of time at rexoncall@rexhealth.com. Join us on April 16th at 1 p.m. right here on WRAL. We'll see you next time.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.